Hi all, thanks so much for attending today. I'm Elisabeth Davies, clinical scientist in Welsh Blood Service. I'm here with Juliet.
And my name is Juliet Bisp. I'm a specialist nurse in donor care at the Welsh Blood Service.
So we've got a very brief presentation today. We don't want to overload you with too much information. So the question and answer session at the end will be available. There's plenty of time allocated if you do have any questions. And we've got contact details available if you have any questions afterwards as well. So plenty of options there. But in the meantime, I'll share my screen and we'll move on to the presentation that we've got for you. So can everybody see the screen?
Yeah, that's perfect.
Yes.
That's great. So obviously you're all here because you have a diagnosis of haemochromatosis, or you may be here representing somebody that does. So myself and Juliet will talk you through the process if you are interested in becoming a blood donor. So I also wanted to cover a little bit about genetic haemochromatosis for those of you who might be right at the start of your journey, having just had a diagnosis, and what the importance is. Why become a blood donor? And is it any use? Does it help you? Who else does it help? There are obviously different eligibilities if you have genetic haemochromatosis, so we'll discuss that. If you do think it's something that you want to do, we'll talk about how you can register as a blood donor, what we offer as a Welsh Blood Service for donors with genetic haemochromatosis, and also for anybody who hasn't already donated at a blood donation clinic, we'll talk you through the process, how it works. It's slightly different from if you're having a venesection in the hospital setting. We'll also talk to you about the Welsh Blood Service website, how you can find further information, how to contact us, and there'll also be plenty of time at the end, as I mentioned, for any questions. So just briefly, many of you will already be aware of this information, but genetic haemochromatosis, or I'm going to call it GH from now on because it is a mouthful. It's the most common inherited disorder in Wales, with as many as 1 in 150 people carrying the genetic mutation. So there's excessive absorption of iron from the diet, but because the body isn't very good or can barely excrete iron, it becomes stored in body organs. So the clinical symptoms are vague, as you probably all know, which is why the diagnosis can be quite difficult if you have lethargy, brain fog, joint pain, low libido. But the clinical consequences, if it's not treated early, can be severe. But obviously the good news is, if it is detected early, it can be easily treated. So as many of you will already be familiar with the process of venesection, we remove approximately 500 ml of blood on a regular basis. That time interval will depend on what your iron levels were to start with, and your doctor or nurse will have decided what needs to be done for you. So that's a very sort of personal interval between your venesections. Your iron stores will be monitored, serum ferritin, TSATs, and I'm aware that most people at the moment are currently venesected in hospital outpatient departments, where unfortunately the blood has to go in the bin and it's incinerated. We can't actually use it in the Welsh Blood Service. But as you've already guessed, venesection is exactly the same as blood donation. So I'll just briefly mention, sorry, my slide's not moving on. Why it might be beneficial to many people to become a blood donor. So currently the Welsh Blood Service supplies all hospitals across Wales, that's 19 hospitals. We supply them all with blood products. These blood products can go to cancer patients, people having surgery, newborns, a wide range of requirements for blood products. Unfortunately, without Welsh Blood Service supplying blood to the hospitals can't function. And this was seen in England back in 2022, when lots of surgery was cancelled because there wasn't enough blood available at the time, largely the after effect of COVID and donors not coming back. So hospital clinics are also under immense pressure. So this is one way that we can support them by encouraging new blood donors to come through the doors for Welsh Blood Service. But currently we are struggling to recruit new blood donors. And last year we had a 42% reduction in the Welsh Blood Service in the number of new donors that we did attract. So if you are interested, your blood is very likely, it can be used rather than thrown away. We can use it to help treat patients. So just briefly, Welsh Blood Service does have responsibilities. So we supply blood components to all hospitals in Wales. So we have to ensure the safety of the blood donors. We want to make sure that you are safe when you donate blood, but we also have to ensure that the patients who are receiving these blood products are also safe. Many of them are really unwell, as I mentioned, often cancer patients. So we need to supply over 100,000 blood products every year to Welsh hospitals. And as mentioned, we do struggle to recruit new donors. So when you do donate blood, it's not just the red cells that we use. You can see plasma and platelets here too. So it's almost 3 for the price of one. One venesection, we can split into plasma, platelets and red cells. And further from that, sometimes the red cells can be split into 6 small packs, what we call pediatric packs, which can be used for babies and newborns and very, very small children. So it's not just one blood product that you're donating, it could be multiple if you come and give a venesection. So I'm going to hand over to Juliet. She's our donor care nurse, and she's going to talk you through a little bit about donor eligibility.
Hi, good afternoon, everyone. So my role in the Donor Contact Centre is working within the clinical support team. I work with another qualified nurse, and we've also got a healthcare support worker who is a very good asset to the team, who undertakes part of the screening for the GH donors that call in. At the WBS, we do have a duty of care, and as Liz has said, we must make sure that the blood is safe for those who are receiving it, and we also need to make sure and ensure that the blood donors are safe during the process, and they obviously are eligible, and we're not putting them at any risks themselves either. So eligibility criteria, we look at age, health, any infectious diseases, lifestyle, travel, also any medical history, and even medications sometimes will preclude them or you as GH patients from donating with us, but obviously we'll discuss that a little bit further on. And also in relation to FAIR, which is the assessment that was brought in around about 2020, where we assess individualised risk that is based on lifestyle and especially on sexual activity and gender, which previously ruled many donors out from giving blood with the Welsh Blood Service. We do ask a lot of questions. So basically our eligibility with genetic haemochromatosis is that you've had no adverse reactions to venesection in the hospital. You're not on any iron chelation treatment, which I believe is an alternative to venesection if you're unable to undergo venesection for any reason, either through needle phobia, you've felt unwell previously, and that you've got no significant health issues or associated issues due to your haemochromatosis. If you are a GH patient, aged between 66 and 72, then although our guidelines do state that to become a blood donor, you need to have given at least one donation by the time you reach your 66th birthday, a venesection at the hospital will count towards this. So there's no reason, if you are over the age of 66 and under 72 that you can't become a blood donor with us. So how to register? Most will be under a care provider at the hospitals, although we do have very few referrals from the GPs. At Welsh Blood Service, we need to know your donation frequency, and if you look on that slide, there is a little picture of the referral form that the healthcare providers will have in the clinics, and during the referral process they do then state how frequently, as Liz explained, how frequently you need to undergo the venesection. Part of the referral then is your donor agreement form, where you're agreeing just to our conditions, that you're aware that the blood is going to be used for recipient purposes, and that you will continue to have your condition managed with your healthcare providers. So obviously it's that you need to have had a definite confirmed diagnosis of haemochromatosis, and although we do accept you as a donor, and you are aware that the blood is not going to be incinerated, as Liz said, we're going to use it for recipient purposes. We may need to advise you to make alternative arrangements should you not quite fit our criteria for donation, and that could be due to travel, any medical investigations that you might be undergoing, and obviously you obviously need not to have had any complications with regards to your haemochromatosis either. Okay, so we've made some improvements in the Welsh Blood Service for the GH donors, that you become sort of priority for our clinics, and we'll always endeavour to meet your requirements for your venesection frequency. We can accept you for as little as 2 weeks to 2 weekly frequency for both therapeutic and maintenance phases. We do carry out the survey of our current haemochromatosis donors, and from these results, the majority are happy with the processes that we have within the Welsh Blood Service to ensure that you're being managed appropriately. So the variety of blood donation sessions will be ascertained by the inputting of your postcode, and we try and make the sessions as convenient for you as possible. Okay, so we've got a short video. As Liz said, you know, it's very different to coming to the blood clinics as going to like maybe an outpatient for your venesection. So we're just going to show you a small video just on the process that you would undergo when you attend one of our clinics.
Start. Are you able to help Abby?
So if you go into the actual slideshow, so if the at the top you can see there's the bar and it says slideshow. There's file, home, insert, design, transitions, animations, slideshow. If you go up to where it says slideshow,
It's like slideshow.
at the top of this, yeah, across the screen, it says slideshow roughly in the middle.
Oh right, got you.
And if you press from current slide, so the second one in.
Oh, right, it's got you.
There you are, and then it'll take you in, and then if you click on it, that's how it worked with me yesterday. I was able to click on it from there.
There we are. So hopefully that's explained a little bit about what happens in the donation centre. A lot of people also ask what happens to your blood after you've donated. So again, it's just another very brief presentation here, just to, I'll have to do the same thing again, won't I? Next. See if I can get this one working. I'll do the whole process again. There we are.
What happens after you donate? Ever wondered what happens to a life-saving blood donation before it's safe to give to a patient in need? Donating blood only takes minutes, but for someone in need, that blood can last a lifetime. After a life-saving donation is made at one of our sessions, it's packaged up and transported to our lab for processing. A blood donation is then split into 3 separate components. Red blood cells.
If you are squeamish, you might want to look away now.
Platelets act as a clotting factor for leukemia or chemotherapy patients, and fresh frozen plasma is used for burns or heavy blood loss. Vital tests are carried out to ensure we provide a safe blood supply to patients. After being processed and tested, blood components are stored in our hospital service department. Each component has a different storage requirement and shelf life. Orders are placed from our 20 customer hospitals across Wales, and your donations are packaged up and taken to patients in need. One blood donation can save 3 lives, and one donation can help up to 6 babies in need of a blood transfusion. We need to collect over 10,000 units of platelets and 100,000 blood donations every year to supply our 20 hospitals. This is only possible thanks to you. Thank you so much for making a difference and for helping to save lives of patients across Wales.
Trying to put this one. Right, so hopefully that's given you a little flavour for how things work if you become a blood donor with the Welsh Blood Service, but just to give you a few things that you do need to be aware of. At the moment, Welsh Blood Service don't monitor ferritin or TSAT, so we can't monitor your iron. It might be something that we do in the future, but you will need to have your iron levels checked whenever your clinical or medical team requests that. So again, just to reiterate, just be aware of any change in medication. Phone in, speak to Juliet or one of her colleagues. Travel, if you have travelled abroad to somewhere where there may be malaria or other diseases, we do need to know about that. Again, lifestyle changes, body piercings, infections, and hospital dental procedures. You may need, Juliet can give you more information on if you have a dental procedure, how long not to delay booking a blood appointment for. What we really don't want is for somebody to book an appointment and be turned away because perhaps you went to the dentist for a root canal the previous day, and I think is it 7 days, Juliet?
Yeah.
So please do contact us if you do want to become a blood donor, and we can give you priority access to booking a new slot if we can't accept you on the day. Unfortunately, occasionally we do have breakdowns with our mobile units. So again, we would try and give you priority booking to help you with that. And we do send a reminder for you to attend. So if, let's say, for example, your donation frequency, your venesection frequency is every 8 weeks, if we have that on our computer system, we'll send you out a notification to remind you to come. We'll send you out a follow-up reminder, and we also phone as well. So whilst we might not be as rigorous as the hospital in contacting you, I think there were lots of options there to help remind you if you do forget. And there's hopefully, can you see the little icon on the bottom right-hand side of the screen? That's a Haemochromatosis UK app that's available, which might be useful. A lot of people report that it's useful to keeping a record of your latest iron tests, when your next venesections are, and any other notes there. So you can go on to, it's available for Apple and Android, I believe. So really, Welsh Blood Service webpage. We've thrown a lot of information at you today, but this is all available on the Welsh Blood Service website should you need it. Log on. It will also talk you through how to enrol. There's supportive information such as the eligibility questionnaire that you can do online, and it will also point you to, you can put in your postcode as Juliet mentioned, and it'll bring up everywhere in your area and when the next donation sessions are. You may prefer to donate somewhere on the way home from work, on the way to work, which may be a distance away. So that's entirely up to you where you want to look at booking a donor session. And just a little bit more information about the web page. If you type in haemochromatosis, we've got a new web page here that's just been uploaded. You can actually download the donor agreement form. So this is just one page. I know it's not very clear, but this is the form that you can download, or your nurse practitioner in the hospital or the medic in the hospital who is looking after you can download. You can give us the information about your frequency of venesection and send that across to us. So that can all be done electronically, should you wish. And again, just to reiterate, we really don't want to turn anyone away on the day. Phone Juliet or one of her colleagues, email the specialist nurses. Just be aware that it's Monday to Friday, 9 AM to 5 PM, but we're good at getting back to you as quickly as we can to help support you find the information that you need. So really just to say thank you for listening. Really appreciate your attendance and your potential interest.